Bonjour, good day. New Democrats believe that everyone in our country should have access to excellent quality, the highest quality healthcare. That means no one should have to worry about having to raise money through a GoFundMe to pay for an operation. That means people shouldn't have to wait for hours and hours in an emergency room to get care. And it means that no one should have to pay $70 enriching Galen Weston and Maple just to see a family doctor. But sadly, that is the reality that we're up against. And in particular, the increase of for-profit delivery of care means that the situation is even getting worse. It means that healthcare workers nurses and healthcare workers in hospitals, emergency rooms are being poached, are being stolen to go to the for-profit clinics. And that means the wait times are getting even longer. It means things are even worse. It means that right now people are getting cash for care. You can pay money. If you got $30,000 laying around, you can get a hip replacement surgery. But those who don't have that money, they have to wait. There's already two-tier care. And the Conservatives and Pierre Poilievre are happy with that. They think that's great. They've been wanting to starve the healthcare system, to open up the door to their buddies, to make lots of money off the desperation of Canadians, off the pain of Canadians. And that's wrong. It's only making things worse. But I am surprised that Justin Trudeau has done a major flip-flop. He used to be against for-profit care, now thinks it's a good thing. So in our Opposition Day motion, we're putting a choice in front of parliamentarians today. Do they believe that we should strengthen our public healthcare system so that no one has to wait to see a doctor in an emergency room, that children don't have to struggle, unable to breathe before they're seen in a children's hospital? Do they believe in making sure that no one has to worry about having extra money laying around to be able to get the care that they need? Do they believe in strengthening our healthcare system? Or do they agree with the Conservatives and the Liberals that a for-profit American-style healthcare system is a good thing, where we're seeing more and more wait times, where our public healthcare workers in hospitals and emergency rooms are being pulled out of those important places of work into a private clinic and making the wait times even longer? That's the choice in front of parliamentarians. That's what our Opposition Day motion is about. That's what we're going to be debating today, and the vote will be in a couple of weeks. The choice is clear for me and New Democrats. The choice is clear. We believe in making sure that you can get care when you need it. We believe that you shouldn't have to worry about paying for care. We believe in making sure that we have a strong healthcare system that responds to your needs when you need it. You go to an emergency room, you get the care you need. Your child needs help at a children's hospital, it's there for you. That's what we believe in. And as Prime Minister, that's what I would do. Defend that system so it's there for you and your family, so you don't have to worry, you don't have to be uncertain. The care that you need is there for you, and you don't have to pay out of pocket. And right now, if you believe in public health care, the choice is clear. New Democrats are there for you. If you believe in for-profit American-style health care, well, you've got two choices, either the Liberals or the Conservatives. That choice is going to be in front of parliamentarians today with the debate we'll have, and again, the vote will be in 2 weeks. Donc aujourd'hui, je veux parler des soins de santé. Notre vision, c'est clair, on veut avoir un système de santé, des soins de santé qui sont là pour vous quand vous en avez besoin. Ça veut dire que vous ne devez pas attendre des heures et des heures pour recevoir des services à un centre d'urgence. Ça veut dire que vous ne devez pas lever des fonds pour avoir accès aux opérations. Mais malheureusement, ce n'est pas le cas. Et à cause des services de santé à but lucratif, la situation va empirer. Parce que plus d'investissement dans un système à but lucratif va dire que ils vont voler les travailleurs du système public. Ça veut dire voler des travailleurs des hôpitaux, des centres d'urgence. Ça va empirer les temps d'attente. Ça va empirer les choses. Et je ne suis pas surpris que les conservateurs célèbrent cette chose parce qu'ils veulent réduire l'investissement pour les soins de santé pour ouvrir la porte aux privatisations à but lucratif parce qu'ils veulent que les grandes entreprises exploitent les gens et gagnent des grands profits. Nous sommes contre ça. Mais je suis surpris que les libéraux et que Justin Trudeau appuient la privatisation à but lucratif parce qu'elle était contre ça il y a 2 ans. Elle a dit que c'est la mauvaise chose à faire. Maintenant, elle a fait une volte-face majeure et elle dit que non, c'est les bonnes choses à faire. Et ce n'est pas du tout le cas parce que on a vu avec de claires preuves que ça va et ça empire les choses. Donc, on va mettre un choix devant le Parlement. Le choix, c'est est-ce qu'on va défendre notre système de santé publique. Ça veut dire que tout le monde peut avoir accès aux soins quand ils en ont besoin, qu'on n'a pas, on ne doit pas attendre des heures et des heures pour recevoir des services dans les centres d'urgence et qu'on ne doit pas payer pour des opérations. Ça, c'est un choix. Ou l'autre choix, c'est de continuer de laisser plus de soins de santé à l'américaine, comme Justin Trudeau et effectivement Pierre Poilievre veulent. Donc ça, c'est le choix. On a une journée d'opposition aujourd'hui. On va avoir un débat aujourd'hui. Puis dans 2 semaines, on va avoir le vote. Donc le choix est clair pour moi et pour mon équipe. On appuie notre système public. Comme Premier ministre, je serai là pour défendre ce système, pour s'assurer que tout le monde ait accès aux soins dont ils ont besoin. Merci. With that, I'm ready for any questions you might have.
Yeah, Mr. Singh, once you start to see the bilateral deals start to take shape between the federal government and the provinces, if you aren't satisfied there's enough in there to protect public health care, would you be willing to pull out of the supply and confidence agreement?
Well, that's not a decision we're making today, but it is important that we make clear the distinction. Canadians also are seeing a choice emerge in front of them. It's clear where the Liberals and the Conservatives stand. They both are supporting a for-profit delivery of care, which means cash for care, which means you can jump the queue, you can jump the line if you've got enough money. That means you can spend thousands of dollars for an operation, and people are desperate, and they're doing that. But that is the wrong way to go. We've seen where that ends up, the American-style healthcare, which is horrible for people. It creates two-tier. It's not good quality. We know that with private care and for-profit care, particularly with for-profit care, quality goes down, costs go up, and the overall crisis that we're going through gets even worse because we know that to put more money in the private system, the for-profit system, will mean that those workers will be stolen from the hospitals, the emergency rooms, the children's hospitals. And so the choice is going to be in front of Canadians. Who do they want to defend their healthcare system to make sure that their families don't have to worry whether they're going to get care in an emergency room, whether their children are going to get care at a children's hospital? That question comes down to who is going to defend the public system that's there for people, that doesn't require you to pay, or who's going to continue down this American-style healthcare approach, which the Liberals and Conservatives seem to be there for. We made our position clear, and we're putting forward a debate today to convince folks to change course. Let's go down the path of defending the system that we have that Canadians are so proud of.
Okay, Mickey.
Oh, thanks.
Do you want to follow up?
Just a different topic, but just with with Brenda Lucki announcing her resignation yesterday, what do you make of her resignation, and what would you like to see considered with the next RCMP commissioner, Sib Whiteman?
Sure. I wish Ms. Lucki well on her retirement. I think it's clear, though, there's been significant problems of systemic discrimination in the RCMP, serious problems of treatment of Indigenous people, racialized people. We saw real concerns about the treatment of women, the fact that a number of assaults against women, investigations weren't conducted properly. Many of them were ignored. So there's serious problems in the RCMP that need to be addressed. And the next choice of commissioner will be very important in addressing those systemic problems. That's a lot of hard work. I believe that the people and the forces are ready for that work, but we need to have clear direction and clear guidance to actually solve these problems. And the problems are severe. They are quite serious, and they're going to require some hard work. So the next choice has to bear that in mind, that we need someone who's going to be willing to make the changes necessary to fix those problems in the force.
The Emergency Act Commission might table their report tomorrow, which is what we're hearing. How confident are you in the process of, I guess, this whole thing?
I think there's been a very thorough process, and I think that's a positive thing. I want to highlight, though, we knew from the moment that the Emergencies Act was invoked that represented a failure. It represented a failure on a number of fronts. A failure on all levels of government to respond to the serious problem of the convoy. It meant that the Prime Minister didn't take it seriously. The Premier certainly didn't take it seriously. Doug Ford ignored it entirely. And the Mayor of Ottawa ignored the seriousness of the problem. And the problem was really clear. We had citizens that were being harassed and intimidated, food banks where staff were being harassed. This was an ongoing thing, not one-off scenarios. We had people that were wearing masks were being intimidated and harassed in the streets. People faced the worst lockdowns that they'd ever experienced throughout the pandemic in Ottawa. The citizens faced the worst of it because of the convoy. Businesses were shut down. Kids were struggling to go to school. People couldn't sleep at night. It was pretty horrible. And given how bad things were and how people were being targeted, all levels of government failed the people of Ottawa and also failed workers. Thousands of workers lost thousands of hours of work because of shutdowns at the border. And none of this was taken seriously. There was a failure of policing. It's very clear that all levels of policing also failed to take this seriously. It should never have got to this point. And so that's why I think that the commission, the work of the commission, is so important to identify how we can prevent those failures from happening, because it was as a result of all those levels of failure that we had to invoke the Emergencies Act, and that it was in no way a success. It was an example of the serious failures that occurred to get us to that point. So I'm hoping the commission will highlight how we can avoid getting to that point in the future.
What do you want to see addressed in the report once it is tabled?
Well, I'm hoping that there is a serious consideration of the problems in policing, the fact that there was a lot of evidence that came forward of police colluding with the convoy, supporting the convoy. And it's important to keep in mind, the convoy made their goals very clear. The convoy, the organizers, there's maybe many people that maybe didn't know this, or maybe people that were unaware or weren't participants, but the organizers, the central organizers, made it very clear what their goal was. Their goal was to overthrow the government. They didn't hide that. They stated it very boldly on a website. They've repeated it in numerous press conferences. They wanted to overthrow a democratically elected government with a committee of their own choosing. I mean, it was very clear what their goal was. And the fact that policing and other levels, other security forces were colluding with these folks is deeply concerning. Like, their goal was not an innocuous goal. Their goal was to overthrow government. And to replace it in a fascist way without having any elections, without having elected officials. Pretty serious that security forces were still working with them despite their very clear stated goal. So that's something that I hope is addressed. And again, the ultimate failures that got us to this point, I hope are addressed. What can be done in the future to prevent that from happening?
Hi, it's Richard Raycraft from CBC News. Thanks for taking our questions.
Of course.
CBC is reporting that the RCMP's watchdog ruled Mounties in Saskatchewan failed to properly search for a missing woman who died of hypothermia not far from where she was last seen. What do you make of this case?
Really heartbreaking case, incredibly heartbreaking case. Hearing some of the details of the father of the woman that was missing and then ultimately died, his requests for help going unanswered. There are some serious concerns raised here. It's heartbreaking that a family member would try to seek help and not get it, and then as a result, a young woman lost her life. I mean, this is really horrible. And again, another example of some issues that need to be addressed, some serious issues that need to be addressed in the RCMP and in policing.
And just to follow up on that, Commissioner Lucki agreed the officers should face a code of conduct process, but the local division disagreed. They called it inappropriate. Do you have any concerns about how Mounties are disciplined for misconduct?
I think the discipline process should be a strong process. It should be transparent. It should hold to account when things happen that are inappropriate. I think that's something that Canadians would expect should be the case, and I think it's fair to expect that. I also think that beyond individual disciplinary action, we do need systemic changes to address the approach to problems. And as I highlighted before, the approach to things like the treatment of Indigenous people, the treatment of racialized people, the treatment of women. And that's a really serious one as well. We can't highlight enough how women and the concerns of women were ignored in a systemic way in a number of cases. I think it's quite a high number, over 1,000 cases where serious allegations of violence against women were not properly investigated. So those are all serious concerns that go beyond individual disciplinary action and go to a systemic problem that needs to be fixed.
Do have questions online, so Cormac McSweeney, go ahead.
Can you hear me okay?
Yes, we can.
Excellent. I first off just want to ask about the bill that was just tabled in the House of Commons from the Federal Justice Minister. It is aimed at creating a new independent commission to review miscarriages of justice, wrongful convictions in Canada. Obviously, people of the Black, Indigenous, and marginalized communities are disproportionately convicted in Canada. So this might help people in those situations a little bit more. But it takes the issue out of the hands of the minister's office and puts it to an independent commission. I'm just wondering what your reaction is to this, whether this goes far enough to deal with miscarriages of justice in Canada, and how you might think this might impact, communities that do face disproportionate convictions.
Well, this is actually very good news. And I want to acknowledge that Randall Garrison played a strong role. One of our New Democrat MPs played a strong role in pushing for this. to make this happen. So I want to acknowledge that this is a very positive step forward. There have been a number of advocates across the country, and there's too many to name, that have been very vocal on fighting for justice for those who've been victims of a miscarriage of justice. And so this is a testament to all the work of so many activists, so many lawyers and advocates who've raised these concerns. And you're right, this is going to disproportionately, hopefully, benefit people that have been for a long time disproportionately impacted. So those who have faced those more marginalized communities that have been more likely to be victims of miscarriage of justice. So Indigenous community members, racialized, and other marginalized groups. So this is a positive announcement. And the next step is going to be in the implementation. The process, or the idea of having it independent from the minister's office, is good. But now the next big step, or the next phase, is going to be how this is set up, the principles by which it's set up, the process, the proper funding, to then actually do the work, the important work. So that's going to be the next stage of our efforts as a party. We're going to be pushing for steps to be taken to ensure that the commission is properly funded, so that it runs well and that it has the right principles guiding it. But this is certainly a positive step and something that we welcome.
And as a follow-up on the topic of the day with your motion, I'm just wondering, because your motion in the wording is quite vague. It just says fix the loopholes in the Canada Health Act. And I'm wondering if you can get way more specific on that, because doctors' offices in Canada are private small businesses. You have clinics like the Shouldice Clinic north of Toronto that does hernia operations, that helps ease the burden on surgical rooms in Toronto. NDP Leader Jack Layton used the Shouldice Clinic himself for a hernia operation. So, where is that fine line in the Canada Health Act where you feel like this is acceptable or this isn't?
Thank you for the question. Yeah, there's a lot of really clear areas where we pointed out things like Maple, which is owned by Loblaws, charging Canadians to see a family doctor. This shouldn't be happening. This has been raised as a concern. There's been some great investigative journalism on this. Another example of a major flaw that can actually be immediately dealt with. It may require additional steps in the Canada Health Act, but it may also be something that the minister can deal with directly, is the fact that right now there is a practice going on where someone in one province, so let's take Ontario for example, that needs a hip replacement can go to another province in Alberta and spend $30,000 and get the surgery done. And what's being used as the rationale is that they're getting services that they're not insured for. And the way they're saying that is that they're not insured for it because they're from a different province. Really, that is a breach of the law. And the former Minister of Health for the Liberal government, the former Minister for Health, Jane Philpott, said clearly this is against the law. That's as a former minister speaking. So it's clear that that's something that can be enforced. That's something that should not be happening. The fact that people are so desperate to have to pay that money and then are going out of province and paying $30,000 for surgery in Canada, just going from province to province, is clearly a problem. And the reason why it's a problem is that it sets up a two-tier system. So someone who doesn't have $30,000 laying around can't get care, and they end up waiting longer and longer. It also continues to balkanize or to cannibalize the existing public system. So you've got people that are working in hospitals, working in emergency rooms, working in children's hospitals. Those workers are already struggling because they're short-staffed, they're under-resourced. They're pulled out of that system and hired into the private one, the for-profit one. And then as a result, there's even more delays for people in children's hospitals, more delays in emergency rooms. People are left with more worry and uncertainty. So these are serious problems, and they can be dealt with. And really, it's a choice. Does this Prime Minister, does Justin Trudeau want to stand up and actually prevent this from happening, prevent the problem from getting worse? Or will he continue to allow this American-style healthcare to grow? And eventually, in a decade from now, we don't recognize our Canadian healthcare system anymore. And it is no longer the public universal system that we believe in. And it becomes this two-tier system where you can pay cash for care. And it's about for-profit. It's about companies receiving more and more profits in their pockets rather than people getting care. That's really what we're up against. And that's why I think it's so serious. And I think it's such a major flip-flop of the Prime Minister, who acknowledged that this was a problem 2 years ago, campaigned against it, said this is a problem, said this is wrong, and now saying it's okay. Pierre Poilievre, of course, thinks it's okay. That's what Conservatives do. But really, our motion is about saying, what direction do we want to head in? And those clear examples that we have, those loopholes that can be shut down right now, need to be shut down. We need to defend people getting the care that they need and not having to worry about if they've got enough money in their bank accounts to pay for it. That it's a universal, public, high-quality care for everyone.
Yeah, the government always says, you know, oh, when there's a contravention of the Health Act, we claw back money. But does that really do anything to deter them from still offering these services? Because sometimes in cases they're clawing back money, it's only like tens of thousands of dollars. And it doesn't really seem, maybe it doesn't seem like an incentive.
I think there's a number of tools. There's fines that can be levied against companies. Those fines can be very stiff. There are other ways to negotiate with the current negotiations. The one-off negotiations between the bilateral agreements between provinces. There's ways to say, you know, we will absolutely be able to deliver this funding, but you've got to require that none of this money goes towards for-profit care. And we've got to also keep in mind, like the for-profit care, the problem with for-profit is, first of all, it's profit-driven. Anytime we've got profit-driven in healthcare, there are going to be serious questions. If you got to spend $100 on healthcare and it's for-profit, well, some portion of that $100 has to go to profit. That's inherently the way it's designed. That means that all the money is not going towards care. So what is it? Is it going to be $20, $30, 20, 30% of that money going towards profit? Then where does the rest get made up? Is it in cutting the hours of care? Is it in cutting the quality? Is it cutting the staffing levels? And let's put the hypotheticals aside. We saw it happen in our long-term care homes, where clearly with very concrete evidence, the for-profit long-term care homes were where we saw the worst conditions of care. And it's not surprising because to make those profits, they cut corners. And we saw it. This is not speculation. Military went in, Canadian Armed Forces, who have seen horrible conditions in the military, and they saw seniors crying out for food and water because they were understaffed. There was not enough staff in those for-profit centers. They saw seniors left in soiled diapers and linens because there was not enough care. We know that for-profit does this. That is what happens. It is about the greed of these companies making money, and then people suffer. And that's what we want to prevent. We want to prevent that from happening. We also know that the problem that we're up against is a shortage of healthcare workers. The for-profit delivery won't fix that. For-profit will only exacerbate that problem. So it's really clear that we've got to push back against this, and we've got clear evidence that it's the wrong thing to do.
We have no more questions. I have nothing online.
Okay, merci beaucoup. Thanks so much.